Hello, this is Tom Still from the Wisconsin Technology Council, and thank you for joining us on today's edition of WisBusiness.com, the show. The show is produced in conjunction with the Tech Council and WisBusiness.com, and with the help of our sponsors, BDO, UWM, and Exact Sciences. Thanks again for joining us for the show. Some events that are coming up we want to tell you about and hope you have a chance to sign up. Our annual Wisconsin portfolio was published recently. This is our look every year at what's going on in the early stage investment economy in Wisconsin. And so we have 7 different events scheduled, one of which we hope you can attend. July 26th, Titletown Tech, July 27th, Door County Landmark Resort, and July 28th, Eau Claire CoLab. Those are the first 3 coming up this week. And go to our website. You can find out a lot more details about times and everything else that are needed to take part. August 16th, we have our Play at the Lake Best Ball Golf Outing. This will be held at the Lake Arrowhead Pines course, about 14 miles south of Wisconsin Rapids. You can register now at again at our website, WisconsinTechnologyCouncil.com, and on our home and events pages. And coming up, this is something that young companies should keep an eye on in terms of registration information and application information. It's our Wisconsin Early Stage Symposium, which will be held in person November 3rd and 4th at Monona Terrace Convention Center. So those and other events you can find on our website. We recently held the finals, the Diligent Dozen, for the Wisconsin Governor's Business Plan Contest during our Wisconsin Entrepreneurs Conference in June. This started with 250 plus contestants and boiled down to those dozen who competed live that day at the Entrepreneurs Conference. One of our category winners was Bree Laughlin of Nurse Disrupted. And what you're going to see now is her presentation as it took place that day.
Well, hi, I'm Bree Laughlin, CEO of Nurse Disrupted. We're a Madison-based health tech startup, and we're committed to bridging the digital divide. You're looking at a photo of the Care Station. This is our all-in-one video kiosk designed for clinics with few resources. Here is a picture of the first site I designed the kiosk for. It's a utility trailer. At the beginning of the pandemic, Madison's homeless shelters didn't have access to clinicians for COVID-19 intervention. There was no budget. There was no IT team, no internet, and no volunteer staff. I had to make a video station so simple it simply worked, and it did. We've expanded now and connected over 19,000 patients across 250 providers. So the problem I had to solve to expand telehealth to homeless shelters is a problem that needs to be solved for clinics across the US. Well, there's this massive provider shortage, and it's amplified in underserved areas. But then there's 3 big barriers to telehealth expansion, and that's cost, connectivity, and complexity. $20,000, the average cost for a video kiosk is unaffordable. 70% of the US can't navigate complex technologies, and 33% of the US doesn't have the internet speeds to maintain a video connection. So here's the Care Station. It's our all-in-one video kiosk for areas with low resources. It is revenue generating, pays for itself, it's simple, and it's connected. I want to tell you a story about Mary. It'll show you the Care Station at work. Mary's from Menominee. At 80, she needs to work with a team of healthcare specialists. Her primary care physician is 20 minutes away at her local rural health clinic. But even if she could still drive, it would take 10 hours of driving monthly for her to see all of her specialists. Mary's clinic buys the Care Station. Now all of her appointments are 20 minutes away, and the clinic generated $32,000 in site originating fees for hosting the video visit. This helps keep rural health clinics open. So again, our product, simple is really hard. From the software, hardware, security, regulatory compliance, we take the full lift. How big is the market? About 500,000 care locations big. That means if we capture 14% of our serviceable, attainable market, Nurse Disrupted becomes a $1.4 billion company. The time to address this market is now. The American Rescue Plan has about $680 million on the table to expand telehealth, and that has to be spent within the next 5 years. So how are we going to get there? Well, We keep the cost recoupable by our target market. Each station is $5,600 with a recurring annual maintenance fee of $3,600. And then there's a one-time mobilization fee for workflow design, training, and initial configuration. For attraction, I just went to market with a care station in January. We have a contract with Washington State Healthcare Authority, so that's their Medicaid branch. Our sales pipeline currently includes a second state Medicaid agency, a health plan, a rural health system, and university clinics. Last month, the Medicaid agency asked if we could have 1,500 to 2,000 stations to them by January. I'm here to get to yes. So when we look at our cash flow, I want to draw your attention to 2022, because that's answering the question, can we get 2,000, 1,500 to 2,000 care stations live? And if we get to yes, then here's our revenue. And if we expand across state Medicaid agencies, then we can get to 85,000 units by 2026. Here's our revenue. Here's our operating margin. Our team. I've been in nursing for 23 years. I was at Epic for 8 years before starting Nurse Disrupted, where I designed 2 products and managed 6. My business partner, Tracy Zvenyich, has been in nursing for 17 years. In DC, she served as a policy advisor and worked on important healthcare legislation. Healthcare technology and innovation must be informed by policy and legislation, which we bring together as co-founders. Financial. So currently we're fully grant sales and self-funded, no debt, and we are raising our first 1 million. Funding telehealth expansion is available now. Nurse Disrupted is ready now. Thank you so much for your time.
Congratulations again to Bree Laughlin and all of the contestants in the 2021 Wisconsin Governor's Business Plan Contest, which we began in 2004, and it's been a success ever since for Wisconsin's early stage sector. I mentioned earlier the Wisconsin Portfolio, our annual publication that takes a look at all kinds of early stage deals in Wisconsin. In 2020, which was supposed to be a down year because of COVID, but it wasn't, we had $485 million in angel, venture, crowdsourced, and venture debt deals spread over a number of sectors. We saw a continued rise in larger investments, which we think is a great indication of the maturing of the Wisconsin early stage economy. Now, we're still trailing our neighbors, though. There's still a lot going on in other states that where they're raising more than we are, and we need to step up on that. So a lot of work yet to be done. And again, with the portfolio, we have 7 different events coming up. And this is not only an opportunity to hear about the portfolio itself, but to meet Joe Kramer, who's the director of our Tech Council Investor Networks, and just to get to know us a little more. And this is where entrepreneurs and investors both can connect and have a chance to talk and really get more tied into the early stage economy in Wisconsin. So again, Titletown Tech in Green Bay will be July 26th. Door County's Landmark Resort will be July 27th. Eau Claire's CoLab, July 28th. We go to Beloit and the Iron Tech Accelerator there, August 2nd. Madison Serendipity Labs on August 3rd. Milwaukee's No Studios, August 4th. And the Idea Fund of La Crosse on August 9th. Again, you can sign up for all of these and more at WisconsinTechnologyCouncil.com events. Thanks again to our sponsors, BDO, UWM, and Exact Sciences. We'll see you next time.